everybody, to the Glenn's on Men's Health podcast. My name is Cameron Glenn.
And I'm Dr. Jordan Glenn.
Thanks for joining us again. This is podcast number 5. And this is the official podcast for Thunderbird Men's Health.
Nice.
That's right. I like that little song there. Yeah, so we're a men's health clinic located in the Phoenix area, specifically Peoria, so Northwest Phoenix. We do all sorts of men's. We the business does it. Really, this is the guy behind it all, Dr. Jordan Glenn. So yeah.
I'm board certified general surgeon, man of many talents, I guess.
Absolutely, and humble as well.
Yeah. I'm so awesome, guys.
No, seriously, you do look good on camera. You sound good on camera.
Stop.
Yeah.
Thanks, brother.
Sure thing, dude.
We gotta toot each other's horns once in a while, but really, the man behind this podcast and so many other things is Cam here. So
it's fun. It's fun.
Yeah.
Just a little bit of a background. I mean, we haven't really worked a lot together. I think we're probably going on to our second year of doing men's health stuff, but just kind of working together in the same office. We're coming up on just over 6 months now. Mm-hmm. So far, so good.
So far, so good. We haven't had to throw anything or beat each other up or anything like that.
Yeah.
It's been fun, actually.
I think when I first got here, you're like, we're probably going to bug each other. We'll probably annoy each other. I'm waiting for that to happen.
No,
because
it hasn't quite happened yet. You're a good guy to work with.
Yeah, you too. Good times. So the format for this, if you're joining us for the first time, is just kind of like we chat a little bit about men's health things. And then we get into questions that we think that guys are going to want to ask about, which, kind of leads into some of the services that we offer as well. And couple podcasts ago, we talked about me getting into TRT. Again, we talked about the benefits of it. My T was really low. What did we say? Do you remember what it was?
It was just over 200 on your total, which is
right.
It was like 220 or something, as I recall.
No, it was actually lower than that.
Was it?
It was 120.
120?
Yeah, 120. Yeah.
You poor man.
I know, right? I know. Yeah, totally.
So very low. We got to rule out some other things. Obviously, metabolic syndrome, obstructive sleep apnea is something that you have to consider before,
right.
For most men. Poorly controlled diabetes. Obviously, you're not a diabetic, so that wasn't an issue.
Sure.
But once we sort of kind of looked at the general health of a man, it's time to really consider TRT.
Yeah.
Because we're brothers. And certain restrictions that are in place for controlled substances, I wasn't able to write your TRT for you or prescribe it for you.
A little bummed about that, but
yeah,
it's all good.
So we did send Cam through a different service for his testosterone replacement, and who shall go unnamed. Currently, it was a bit of an adventure, though, wasn't it?
It was, yeah. Kind of figuring out which one to go with. I mean, one initially was like, okay, well, let's do this one. And then I tried to get online to do the virtual visits, and we finally got the stuff.
So you did your first injection last night. Mm-hmm. And how was that?
We didn't really need the instructions, but like as kind of a educational experience. No, I think I left them at your house.
Okay,
but it was like the crappiest photocopied instructions.
Couldn't
I've
even
ever
read
seen.
it. I think it was written in 0.6 font or something.
Right.
And it was all faded. It was really bad.
Yeah, like the ink cartridge was running out or something. Like half the page you could read, and the second half you couldn't.
Really bad.
Yeah.
Now you just so you guys know, testosterone cypionate, which is kind of I think probably most commonly used testosterone for injection replacement, can be injected either subcutaneously or intramuscular. In the case of what you got, they gave you equipment, needles essentially, for a subcutaneous injection.
Right.
Subcutaneous injection is generally easier to do. It's a little bit less painful. That muscle, the fascia over the muscle has quite a few nerves in it. So when you're trying to inject into the muscle, it can be a little bit more painful. Some formulations of testosterone, like what you'd get commercially from like CVS or Walgreens, commercial drugstore, is usually a testosterone cypionate. It's the same drug, but it's in a grapeseed oil, which is kind of like a thicker oil. And that pretty much has to go in into the muscle.
Right.
I mean, I guess technically you could inject that sub-Q, but it has to. It kind of can't be injected through a small needle just because of how thick this stuff is.
Right.
Yeah.
Yeah. Bringing it back to our experience yesterday.
So that product is a sesame seed oil.
Yeah. It took a while to kind of fill up the syringe, and then it took even longer to inject it.
Yeah. So that's like an insulin syringe.
Right. Yeah.
It's generally not how I recommend doing it. I think there are better options out there. Most of my patients I place on a product that is an MCT oil based. That's medium chain triglyceride. First of all, it's a lot less prone to allergic reactions. You know, obviously, if you're using a seed oil like sesame seed oil or grapeseed oil, there's going to be people out there that are like allergic to certain oils.
Right.
So MCT oil is kind of hypoallergenic or less likely to cause an allergic reaction, and it's thinner. It's like more viscous, so it's easier to inject it into a sub-Q space.
Now, intramuscular and sub-Q, if you were, would the injection rate differ even if you had like the same gauge needle? Like would muscular
No, not
takes
really.
the same amount of time? Okay,
It's about the
tissue doesn't matter.
Tissue doesn't matter. It's the size of the needle, and we were talking just before this, but it's about the resistance along the needle, and as you go down in the size of the needle, which needles are measured in gauge, so the gauge goes up. Like for example, an insulin needle is like a 30 gauge needle. Yeah. But as you go up in gauge, down in the size of the bore of the needle, it actually increases the resistance to the fourth power. Like the formula is based on the radius to the fourth power. So it gets where you really have to push hard to get that stuff
to get it
out.
through there. Yeah.
You know that you're stuck with a needle in you for like a few minutes at a time.
I know. Yeah. I was saying, even though I could hardly even feel it, the fact that I was sitting there and my hands kind of shake a little bit. So it was like,
shaking.
Got a little bit uncomfortable after a little while, but yeah, I'm kind of a wuss when it comes to needles anyway.
I thought you did fine.
Yeah.
So
I had to take a little minute, pet the dog, have a brownie.
Just a regular brownie.
My lips were getting just a little bit tingly, but I'm getting better at it. Getting better.
Yeah. There are, I think it can be done better. So if you can just go with a slightly larger needle, from a 20 or from a 30 gauge up to like say a 27 gauge or even a 25 gauge, you're just gonna have a much better experience. It draws up easier, it injects easier. So I actually got some products out here. This is just a 1/2-inch needle. It's a little shorter than probably what you want. If you're ordering a needle like off Amazon or medical supply, a 3/4 inch needle is probably ideal. So 27 to 25 gauge, 3/4 inch needle. Obviously, when we prescribe TRT to our patients, we're going to give you supplies. It's going to come with everything you need. This is another option. This is a self-contained syringe and needle together. In this case, this is a 23 gauge, 1.5-inch needle. If you're doing an intramuscular injection, this is ideal. Okay, you can draw up really easily with this to your 0.5 or whatever your dose is that week, and then put this in and inject it. Now we're back. By the way, these are Nerd Juicy gummy clusters. These are highly recommended. My medical recommendation that when you need some candy, these are good in moderation.
I love those. Yeah,
so good.
The gummy with the nerds. Yeah,
it's like the combination of crunchy, chewy, sour, and sweet. Yum. Okay.
Yeah, with like a spoonful of injection, you gotta have a little bit of sugar to go with that, right?
Yeah, you need a little like a sucker or something after that.
Something to go with it. Yeah.
Yeah.
Cool.
Other thing that I thought was interesting is your TRT came with recommendations for twice a week dosing, or I believe it was like they said every 4 days, which is essentially twice a week. I think most patients can get by just fine with a once a week injection. Although and this is really for me personally, I started to notice a bit of a nadir at the end of the week, where I was experiencing kind of some symptoms of just feeling a little low. So I do personally dose twice a week, and I think that can be a good strategy for a lot of people.
Yeah, I think that was the recommendation too with the stuff that came. Yeah,
I've seen dosing as infrequent as once every 2 weeks.
Oh, really? Is that like a larger dose though? Typically, I guess it would depend on the individual. Yeah.
Yeah, it would depend on the individual, but generally, yeah. I guess the gold standard. I mean, the sort of, it would be amazing if you could just do more of like a depot shot, where you just inject somebody once a month or once every couple months.
Oh, right.
A lot of guys do implant, get the implants, like the beads. And those can be placed every 6 months or even up to once a year in some cases.
Is that the same as like a pellet?
That's what I meant.
Okay.
I said beads. I meant, like
okay.
a pellet.
Okay, yeah, I just wasn't sure if it was the same.
The problem with that is if your dose is wrong, particularly if it's too high, you're kind of stuck.
Oh, you are,
stuck
yeah.
with it. Yeah. There's, they're generally only removed. I mean, it's like surgery to remove a pellet. I've done it before on patients.
Cut it out.
Yeah, they're generally only removed in the case of like an infection, if it gets infected.
Oh, got it.
And if your dose is like too high and your levels are too high, you're kind of stuck there. So, if you can get it really dialed in and where you want to be, it's fine, I think, because the idea is it's a constant flow. But again, as you get towards the end of when you're needing more, you can be low for quite a long time, before you get your next pellet placed. So, all these different strategies have pros and cons.
Right.
A lot of patients are happy with their gel or their cream. That has its own issues and side effects to it. If you have kids, I would and you ever want to touch them, I would generally not recommend that at all.
Oh, the cream.
The cream.
Yeah.
Because it gets on your hands. You put it on your skin.
Oh, sure.
You wash it off your hands, or whatever.
But there's still like residue.
It gets on your clothes. It's on, and then you touch that area again. You don't realize it. You're touching your daughters and stuff. And there's been plenty of cases of, young kids developing like pubic hair and stuff like that.
Oh, wow. Premature adenarche or that sort of situation.
Yep.
Yeah. Wow. I didn't even think about
Virilization. Yeah. So, but I mean, obviously it's rare, but if you're like an older gentleman, you don't have young family around or something.
Sure.
It's probably safe.
So it's probably just best. I mean, we're definitely making the case for injection here, right?
I think, and it's.
I think what you're getting at is
what I'm getting at is the injection is the most reliable.
Yeah,
it's. I think it's safe. It's just there are some of you out there and people out there that just don't want to inject themselves. They don't want to poke themselves, and that's fine. There's alternatives, but yeah. And
this stuff doesn't need to be stored like in the fridge, right?
No, it's can be stored room temperature. Yep, it has a. Kind of a long expiration date. These oils are shelf stable for quite a while. The steroid molecules are rapidly absorbed from the fat tissue or from the bloodstream or from the muscle tissue. The structure of a testosterone molecule is such that it can pass through cell membranes pretty easly into different tissues.
That's cool. That's cool.
So
that's good. Well, all this information that we're talking about, you can find it on our website. We're going to have some instructions on what kind of needle to use, how to inject it, how to draw it out, those sorts of things. Might have a video clip in there as well.
ThunderbirdMensHealth.com.
That's right. Yeah, I'm just trying to make it easy. I mean, just kind of having this experience myself of going through another company that's doing it and kind of seeing where, we can improve our game and make it really easy for guys to find this kind of stuff. Hopefully when they Google it, like, how do I do this? If they're sitting there with their, trying to figure it out, we'll make it easy for you.
Yeah.
Yeah, definitely.
So I think we'll try maybe next time, if you're up for it, we'll do, intramuscular injection. You want to give it a try? What do you think?
Sure. Is it the same stuff?
It's the same stuff. The same,
Okay.
Well, the same, drug. The drug's the same.
All right. I trust you.
It's just probably a little longer needle. And,
Sure. We can do it.
Just so you can talk authoritatively about
The effects.
or just like how it feels and stuff.
Right. Yeah. I'll do it. And then I'll go to the gym, see how that goes.
Yeah.
Try and keep everything else in my life consistent so I can actually measure. Because you said I am intramuscular, you tend to get a bigger, you see the effects of the TRT.
I think it's more
quicker.
Yeah, it's circulated probably more. I think they're injecting into the fat. There's probably some, fat absorption.
Right.
And so it's probably slightly more, just a slower uptake curve into the bloodstream.
And you inject into the muscle, right?
Me personally,
you do that?
I do,
Yeah.
I've always done it that way.
I'm sorry, it was a personal question.
I'm offended. No,
Rear
it's
of the
fine.
deltoid, right? Is that kind of where you do it?
Yeah, that's where I like to do it, in the shoulder there.
Good.
So.
Yeah, I wasn't sure if you were out about that or whatever.
Oh, I'm out. I am out.
Can't remember if we talked about it. Oh my gosh.
Yeah. The thigh, I just found the thigh to be very sensitive. I think it's painful. Sometimes the muscle gets really sore for a couple of days.
Yeah.
I've noticed that. And my glutes too, the skin on my butt is just kind of sensitive, I guess. Definitely too much information there, but the shoulder, for whatever reason, works.
It's
pretty
easier.
Good.
Okay.
Yeah, I just found it to work pretty well for me.
Cool. Good. All right, let's move along to some of these other questions.
Sure.
Kind of general health questions. So I know that there's a lot of different ways out there that guys can stay healthy. What do you think right now is one of the healthiest, most successful habits that men can incorporate into their lifestyle, into their diet, whatever? Right now, what are kind of one of the two top things?
Yeah. Okay. So here's the thing: we are inundated with ads for supplements and AG1, whatever, super greens, vitamins, all this stuff, and it's hard to know what's going to really make the difference, what's going to really make you feel good, give you that boost of longevity.
Right.
There's a couple simple things that if you're not doing, you need to do. No amount of extra supplementation or whatever is gonna make much difference. But
yeah.
And they're simple things. They're things your mom taught you, really, right? Just eat healthy, okay? But even that takes kind of a second row, in my opinion, to regular just hitting the gym. We need to move. Our bodies are designed to move, and it has so many benefits for us. You can break that up into cardiovascular training and resistance training. I tend to think men, we do well with resistance training.
Yeah.
With scheduled bouts of cardiovascular as well.
Right. And we're talking about cardio, or are we talking about just walking or vigorous exercise, or a combination of that? And for how long? What do you think?
To dial it in, you need to get into zone 3. It's that 70 to 80% of your maximum heart rate. It's a level where you should be able to maintain a conversation.
Oh, right. I've heard that.
Yeah. So a good way to gauge that is if you do monitor your heart rate, which is so easy to do now with smartwatches, or every treadmill and stair machine has a heart rate monitor on it. But if you just take 180 minus your age, that is a good gauge of that zone 3. And so honestly, for most people, walking with a slight incline at a brisk pace, 3 miles an hour is going to put you there.
Yeah.
And so, you don't need to go and you don't need to run, especially if you haven't run in a long time. Please don't go and run, because when you get to be over 40, really the injuries are can be devastating to your cardiovascular health. If you develop, like plantar fasciitis, and you literally like can't walk on a treadmill, like that can be devastating to the months that you're going to spend unable to move physically. Yeah. So
ease into it.
When it comes to like health maintenance, it's about sustainability. It's about trying to it's like what level can you do for 40 minutes, 3 times a week, 40 minutes to an hour, 3 times a week. Okay.
Nice.
So you're doing your 3 workouts a week of cardiovascular, and then you're doing your 2 to 3 workouts a week of resistance training, and that's weights.
Yeah. And I try and switch up the cardio too. Like if I run one day, I'll try and swim the next day, and then I'll try and maybe do elliptical the other day.
Yeah.
Switch it up.
There's some benefit to that too, muscular confusion and stuff. Using different joints, you're not putting too much strain on any specific joint or whatever.
Cool.
Yeah. Now that's the one habit that men, I think, can do to really improve their lifestyle and longevity. Yeah. And the patients, I have patients, in my general surgery practice that are in their 70s and 80s, and it's going to the gym and being healthy for them. It's at least a part-time job. It's just when they retire, they just decide they're going to be healthy and fit, and they enjoy it. They love it. They just lock in on these habits, and they just and
make it part of their day.
Yeah, and a lot of these people, you wouldn't even know they're as old as they are, because they're fit, and they play tennis and do all these other things. So that's the one habit. Now, if you want to talk about other things, obviously hormone replacement and things, these are important things and can be game changers for men, especially when they're really deficient. But just a daily multivitamin is important.
Oh, okay.
Okay.
Even though you're not
I wouldn't
trying to diet or anything like that.
I wouldn't add any other supplement if you're not just taking a daily multivitamin.
Okay. Now I've heard that you take a multivitamin if you're maybe trying to cut certain things out of your diet, but you're saying just make sure you get that just to cover all your bases anyway.
Just cover all your bases.
Okay.
There's you can take the individual vitamins. A lot of I actually supplemented my vitamin D for a long time, and that's often recommended. But there's trace minerals in there, your selenium, your zinc, all these other things that we may or may not be getting through our diet. So
that's interesting. And that's good.
Just if you're going to supplement anything, just a multivitamin.
Yeah, I take fish oil too. I take the fish oil pills.
Fish oil's great for cardiovascular health. Some people need it, some people don't. Some of that has to do with your genetic propensity for cardiac disease.
For me, it's kind of like an ADHD thing as well. I mean, I've heard that it actually has mental benefits. Yeah. Okay. Yeah. EPA, DHA.
You don't mind the fish burps all morning?
No, actually, I don't get those.
Really?
Remember, when we were kids, our mom used to give us cod liver oil that had it was like mint flavored. And that has to be one of the most disgusting. I was traumatized by that. It was so nasty.
She must have stopped doing that by the time.
Oily, minty.
Fish liver.
I know. Well, yeah, I don't remember having fish liver, but yeah, I remember taking. It wasn't for too long, but I do take it now. I take. I don't remember the brand, but I got it at Costco. Literally, like the pill is like almost an inch long.
Yeah.
It's basically like taking a spoonful, but I should probably just no. It's nasty. I get it down. Actually, I can take that and a multivitamin at the same time.
Yeah.
So.
Yeah, there's a lot of health benefits to fish oil as well.
Yeah. So well, that's good to know. It's good. And then obviously, I think you mentioned smoking. If you're doing that, you got to stop. That's an easy one right there.
You got to quit. We talked about that last podcast, and do whatever you can to quit that.
To stop that business. Is there? I know there are a lot of health trends out there right now, and I just noticed that you popped into our kind of our script here. Any health trends that make you cringe, that you're like, what the heck is this?
The whole looks maxing thing, it's kind of well, it's a joke. I mean, let's be honest. It's kind of, it's kind of fun actually to watch, to watch it.
In what way?
I mean, I guess, I don't know even know if you can call it health trends at this point. It's really, some of the stuff can be just very detrimental, and especially when we're talking about surgery and cosmetic surgery and stuff like this. The fact is that, there's other like reasons girls don't want to date you guys. It's not because you don't have a strong jaw. You see some stuff out there that's a little questionable, but it's all for views, right? So,
oh, sure.
Let's just not like use social media as our lens for the world.
Right. Yeah.
Let's go ask our doctor if stuff is safe, and talk to the women in your life and ask them what they're really looking for.
Right. That's interesting. Cause I remember there was this girl that I worked with, and, I asked her about like, hey, do you like my hair? Or like, I'm doing it different. Like, what do you think? And she's like, ask your wife. And I was like, oh, okay. Okay. I wasn't hitting on you or anything. It was just an objective question. Maybe she really didn't like it. Maybe that was just her way of being like, you look like an idiot.
So I think obviously there's things that are neglected, and then there's topics that men probably actively avoid just because they're sort of painful.
Mm-hmm.
And one of those is going to be your erectile dysfunction.
Mm-hmm.
And, it's so common in men as they age out of their 40s, 50s, and 60s is when you start to, you may start to experience some erectile dysfunction.
Mm-hmm.
And that is like a multifaceted thing. There's multiple reasons why you can have erectile dysfunction.
Mm-hmm.
I like to think of 4 different categories of erectile dysfunction.
Mm-hmm.
There's vascular, such as artery disease, a buildup of atherosclerosis.
Mm-hmm.
It goes along with cardiac disease. So that's one aspect. There's psychological, and we see that more in younger men who have issues with erectile dysfunction.
Mm-hmm.
There is the hormonal aspect of it, and then patients with, for example, like with a spinal cord injury,
Mm-hmm.
can experience chronic impotence. Okay, so those sort of 4 aspects of it. The neurologic one is hard to treat, especially if you've had like a spinal cord injury or
Mm-hmm.
or traumatic brain injury or something like that.
Mm-hmm.
The vascular aspect is can be difficult to treat, but often responds well to like a trimix, which is an injected medicine that allows for improved erections. And that also responds well to like the Viagra and tadalafil, the phosphodiesterase inhibitors. Psychological can be complicated. I mean, some people maybe need therapy for that, but there's a lot of aspects to that that's hard to unpack. It's usually more common in younger men. And then the hormonal, obviously, we address that pretty well.
Mm-hmm.
Something that we offer at Thunderbird Men's Health is the Firmex injection, which is it's a botulinum toxin injection,
Mm-hmm.
like Botox.
Mm-hmm.
We usually use a product called Xeomin.
Mm-hmm.
That's injected into the corpus of the penis and helps improve duration of erections
Mm-hmm.
and sort of the quality of the erections. But it only really works for men who are starting to experience the effects of erectile dysfunction. So while sometimes like a Viagra might be used to kind of, for a younger guy might use it just for recreational reasons.
Right.
This doesn't really do that. But for a guy who's in his 50s or 60s who's starting to experience the effects of like maybe you can get an erection, but you can't, finish the deed, or
Sure.
like it's just not a good quality like the quality it used to be.
Oh, right.
This is a really good option, and we've had really good feedback and results with that.
Mm-hmm.
The botulinum toxin lasts for about 6 months,
Mm-hmm.
so it is something that needs to be repeated regularly.
Mm-hmm.
But it's safe. It's relatively painless. Takes about 30 minutes to do that procedure.
Okay.
Yeah.
Cool.
Yeah.
Yep.
So that's something that's probably not talked about enough, but every year, new options are coming out there.
Mm-hmm.
Another option for erectile dysfunction that's gaining some popularity is electroshock, or not electroshock, but shockwave therapy. We're not going to zap it. Don't try that at home,
I
folks.
know, kids. Don't get near the electrical outlet when you're naked.
Yeah.
That's funny.
No, shockwave therapy is it's been used for treatment for joints, a lot of different things. But the shockwave therapy helps improve blood flow to the penis, and can help break up some of the plaques and some of the causes of poor blood flow to the penis. So
Cool.
Something to consider, an option. We actually don't offer that currently, but we do have some partners that we work with, and we can help folks with that as well.
Yep.
All right. Good. Well,
Right.
that's it for today. Thanks everybody for tuning in.
Hey, thanks for watching our podcast today. Don't forget to like, comment, and subscribe for more. And check out ThunderbirdMen'sHealth.com for the latest information on men's health.